to all our witnesses here today. And I think the last 2 years have been the last 2 years have been completely unprecedented in relation to the pandemic, and I think it's probably a time of reflection on how we treat our healthcare staff in hospitals and how public health is delivered. And them 2 years, I think that is time for reflection. And as the pandemic recedes, the fault lines re-emerge in society. And the fault lines that I think have defined this country in the last number of decades has been public health in relation to hospital waiting lists and so forth. So there's obviously a huge issue in relation to reform and regionalisation of the healthcare system. And what most people will, when they're listening to this programme here today, most people will want to hear in relation to public health, or whatever you want to call it, Sláinte care, will it deliver for them? And will, you know, in relation to elective surgery, seeing a psychologist, will it deliver for them? So can you reassure the public that Sláinte care in the immediate and long term will deliver them reassurance to the public?
Chair.
Sorry, Deputy, maybe would I go first and then Paul might come in. Thanks, Deputy, for your comments at the start. My view on this is that, and as Paul and I have set out this morning, and as we set out in a report that the Minister published yesterday, I think Sláinte care is delivering now. It's delivering significantly in terms of reform and the level of activity that has been delivered by the system. So it is delivering, and it will continue to deliver into the future. But of course, there are structural problems within our system, structural problems in relation to capacity within the public system, which gives rise to, as we're debating this week, issues around trolleys, and there's a significant issue around structural issue in terms of waiting lists, where public patients have to wait too long for treatments. But a key objective of the plan is to address through a whole variety of different actions to address those concerns and to improve the performance of the system. And that's what we're doing. And I can definitely say, Deputy, that our focus is to continue to improve the performance of the system. Can any of us give guarantees that we will have no waiting lists or people not waiting on trolleys? No, of course we cannot, given the change in our demography, given the change in demand. But absolutely, I'm confident that we are delivering, and with the support of the Minister and the Government, we'll continue to deliver for patients and for our citizens. Thank you.
Very briefly, Deputy, just I fully share your concerns around what the public will receive and how they will receive it in the coming years in terms of their care. And I do believe during COVID, the public did get a better level of trust and confidence from the health system for a number of reasons. I think we operated as one more integrated health system than the public would have experienced in many times in the past. And what I mean by that was all elements of the health system coming together, whether that's GPs, pharmacies, the statutory hospitals, non-statutory hospitals, private hospitals, the department and ourselves, working in a more coherent and collaborative manner. I think that's what the public expect, and we need to keep that going. But specifically, they will judge us on what their experience is in coming through. And I think we need to be honest, as Robert says, there is not an immediate short-term fix, but we have to focus on some of the priorities. The waiting list most definitely is one of our priorities. What's probably not publicly understood is we do over probably about 3.4 million procedures per year, but we do have about 800,000 or so of waiting lists, and there are people waiting far too long. And we took an approach, very briefly, Deputy, just to give some level of reassurance, in the period September 21 to December 2021, with a joint approach chaired by Robert and myself and our teams, looking at all aspects of public health delivery, private capacity, NTPF, reporting, hospital groups, specialties. What's the 80-20? Which specialties can we concentrate on? How do we focus on the longest waiters? And that's a process that we're going to continue into the multi-annual waiting list. But I do want to be honest with the public and yourselves, Deputy. It's not a short-term fix. It is a multi-annual fix. When I took up this role, I'm sure when Robert took this role, we didn't take it up on the basis that we will solve this in a year or two. And we certainly didn't take it up, you know, with the impacts we've had to deal with COVID. But we're focusing on what the public expect from us.
I think I do agree that we've seen a glimpse of what could be in relation during the pandemic, where there's no such thing as a two-tier health service. There is one health service that delivers for everybody. And we've seen a glimpse of that. And hopefully, I think the majority of people in this country would want to see that service provided for everybody, regardless of your outcome or your income. Just my final two questions is in relation to the Sláinte Programme Board. What is the composition of that board in relation to personnel?
Thanks, Deputy. So Paul and I chair the board, and then our colleagues from the Department of Health and the HSE, senior colleagues, are on the board, and others come in and out of board meetings depending on the topic that's been discussed. So there's a number of us who meet every second month, but there are others then who come in and out, and Caroline is on the call, is involved in convening that meeting, and Jack and others involved in the planning of that. So in effect, it's the senior leadership team, both in the Department of Health and the HSE, supported by our colleagues throughout both organisations as necessary.
And how many members would be on that board?
I think about a dozen, Deputy, but I can check with you.
Okay.
Yeah,
if
a dozen.
And could
Sorry,
you name
can I
them?
just add very briefly, Deputy, sorry. Yeah, just equally as Robert said, from my own perspective at HSE, we have the most senior lead national directors on it who are here with me today. So the Chief Operations Officer, National Director in Community, National Director for Change and Innovation, National Director for Acute Hospitals. And as Robert said, we would, based on the item presented on the day, we will bring in other key leads. And I would just make one very brief point, because I know the whole core of today's discussion is on governance and structures. I've been involved in reform and restructuring and realignment across my whole career, and I think where it works best is where the senior team own it and are responsible and design it and drive it, and I think that's a model that we have. We get the space and time to make it work.
Is there any member of any of the trade unions in the health service on the board?
No, Deputy.
No. Why is that?
There's other fora, Deputy, both the Department of Health and the HSE, where we engage with representative bodies, both formal fora and informal, and that's the way we conduct our business. So obviously, Paul and I are charged on behalf of the government to implement this agenda, and that's what we do, and we're accountable to the government and, of course, to committees, this committee, for delivery of that. But when it comes to matters of staff engagement, there are other structures that we've in place, comprehensive structures which enable us to go about our business, working with various representative bodies.
Okay. And just my final question, and I don't want to kind of personalise this, but Mr. Reid and Mr. Watt, your combined salary is over €700,000 per year. It's an absolutely colossal amount of money. And that equates to 18 nurses' annual salary. Do you think you're worth that colossal amount of money per year, while people are waiting over, in some cases, years in relation to the most basic of public health? Chair,
I'm happy to go. If I'm happy to go answer the question, if that's okay. Look. Thanks, Robert.
Going down this road, it's supposed to be around governance, but I'll allow the question if you want to answer.
Yeah, look, Chair, Deputy, my salary or remuneration package was not designed for me or by me. I went into a very open public competition, and I know Robert will let Robert speak himself, but I went into a very open and public competition, and which I understand was an international competition and was the successful candidate. And that's the process I've walked through. So it's not a salary designed by me or for me. And of course, it's a very significant salary, and I take it, I take my roles and responsibilities very serious, and I will work within my contract to the best ability that I can to deliver my responsibilities to the Irish State public.
Thanks. I'd like to thank John Lahart for letting me in before him. Thanks.